Hi friends, Dr. Nancy Tremblay here, putting the power and knowledge of your health back in your hands. We're going to talk about psoas trigger points today. The psoas, P-S-O-A-S, is a hip flexor muscle. So what it does, it lifts your hip, lifts your knee up, so it flexes your hip. The muscle starts at your spine in your back, and then it actually comes through your body at an angle and ends up at a portion of the hip socket over here. It's a complex muscle, it's a long muscle, and when it gets tight, it will send pain either to your groin, your thigh, or only your back. So that's how it can be sneaky and be causing back pain, and really it's a muscle of the hip. It is a difficult muscle to work on, even for a therapist, and a lot of therapists don't even like to work on it. So our therapists here at Tremblay Chiropractic know how to work on it really well and are experts at it. But let's say you're having a problem at home. Sometimes you might slip on a little puddle of water and your leg kind of comes out underneath you. You don't fall. But that action where your body's trying to save you from falling can cause the psoas muscle to get into spasm. Also, if you're up and down a ladder or a step stool multiple times, that can put the psoas into spasm. So I'm going to teach you how to do these trigger points. Now, as always, when you look for trigger points, you're looking in the muscle for something that feels a little bit like a knot or a thickening of the tissue, and it's sore when you press on it. Sometimes you can feel the referral pain. Sometimes you can feel, for instance, for the psoas, you might feel pain in your back when you press on the trigger point. And you want to hold pressure on each point for 10 seconds, only 10 seconds, because you can irritate these things. You can work on it every day, but only once a day, and make sure when you're working on it that you're breathing deeply, because oxygen helps the muscle to relax. I'm going to show you first the hand technique. So you're going to take your fingers and fold them in, and then you are going to back up your fingers one to the other. It gives your hand a little bit more strength as you work on it. You'll lay on your back. First you want to find the muscle. And the way you find the muscle is you make it contract. If you have problems with trigger points in the muscle is going to be very noticeable. And so the way you find it is first you go to your belly button and your hip, the bony part of the hip here. Midway between is where the psoas is going to be. This is the largest part of the muscle. Like I said, it's a very long muscle, and this is the easiest spot to find when you're working on it yourself. And you just want to lift that knee up on that side. When you lift that knee up, if you feel something hit your hand, that's the psoas muscle. And it's tricky. This is a really difficult muscle to work on. So if you have trouble finding this and you want to have your chiropractor or your massage therapist help you find it so you can help yourself at home, that'd be a great idea too. So once you find the muscle, you're going to turn your knees to the opposite side. So I'm working on my left psoas. My knees are rotated to the right, and I'm using my backed up fingers, and I'm just pressing into the muscle. Remember, you're going to feel for that sore spot. And I actually have a little tiny sore spot right here. I know it's my psoas muscle because when I was looking for it, I brought my knee up to activate the muscle. That's how I know it's my psoas muscle. And then you're going to hold 10 seconds. Breathe deeply, count slowly to 10, and then release that one. And you can look for another one. Remember, the muscle goes under the hip crest here, ends up way over here, starts back at your spine. So you can really work under your hip crest too. You might find some trigger points there. So I hope that helps. Hope you can help yourself putting the knowledge and power of your health back in your hands. Bye for now.